My name is Emily Cullen, and I'm the social worker for this session. My client Mandy is seeing me to work on her severe panic disorder. Her panic attacks are becoming more frequent and severe and beginning to disrupt her life. Mandy is a 26-year-old female with a college degree. Her panic disorder started in college. She was able to manage them for a few years with medication, but they have become more severe, and medicine is no longer managing them alone. Since graduating from college, her attacks stopped for a while, but when she got a job that put more stress on her, they returned with the same level of intensity. She feels that increased stress is the reason for her panic attacks. She's been doing CBT therapy for her panic disorders for 2 weeks. Mandy will be participating in cognitive behavioral therapy and interoceptive exposure therapy to help her panic attacks. Throughout the session, I will be teaching Mandy about cognitive restructuring, calming techniques, and stress reduction. Cognitive restructuring is a method that will make her more aware of her anxiety and panic attack provoking thoughts, becoming aware of automatic thoughts that are causing her panic attacks, and learning calming techniques will help her lessen the severity of her panic attacks and eventually help eliminate them altogether. Relaxation and calming techniques will be vital at the start of her CBT sessions. Interoceptive exposure therapy is a series of exercises that will help her body to get used to feelings of panic attacks. By becoming more aware and okay with these sensations, panic attacks won't be as terrifying and will be easier to overcome. Some examples of interoceptive exposure therapy exercises include limiting breathing, spinning around in a chair to make yourself dizzy, running in place to bring heart rate up, or covering your head with a blanket for a minute to bring on the feeling of being smothered. I'm glad to see you today. How have you been since our last session?
I've been okay. Work is still pretty stressful, which is leading to panic attacks. I'm still having about 4 panic attacks a week. They happen at random times and are taking a while to go away. I find myself avoiding being social and doing things because I'm afraid that I'll have a panic attack.
Okay, so when you're avoiding certain activities, what are you doing instead?
I usually just watch TV or take a nap.
Do these activities lessen the chance of having a panic attack?
Not really. I ended up thinking about the things that make me panic.
What's the worst part about your panic attacks?
Probably feeling like I can't breathe. My chest gets really tight and it takes me forever to breathe normally again.
Are you able to think of any of the thoughts that you're having during these attacks?
I'm not sure. I guess it happens a lot when I'm overwhelmed at work, but they don't always happen at work.
Well, that's normal. Even if you aren't at work, your mind may wander to the stress that is happening at work.
I guess that makes sense.
Have you been doing any of the relaxation techniques that we talked about?
I try to take deep breaths, but I don't feel like that helps very much.
Can you think of some of the things going on through your head when you're taking deep breaths?
I'm thinking about the things that are making me panic.
So you're not thinking about things that might also calm you down?
No.
Okay. So we're going to talk a little bit about automatic thoughts and images. When you start to panic, what are the thoughts going through your head?
I get overwhelmed and start to think that there's not enough time in the day to get my work done. I feel like I won't do my best work because I'm rushing and then I'll get in trouble at work, and that's when I start to panic.
Good. I'm glad you're able to notice those thoughts. So when you're trying to calm down and take deep breaths, you also have to change your thinking. You have to say things to yourself such as, I will make time for all of my work, even if I have to stay late, or my boss wouldn't give me the work if I couldn't handle it. This is something we call cognitive restructuring. You are giving your brain other options to think of instead of just the negative ones that you're already thinking of.
That makes sense, I guess. I can try those things too.
Awesome. This stuff won't be easy. You'll have to actively work in changing your thoughts. But now that you know about these things, you'll be more aware of your thoughts during a panic attack.
Okay.
Okay. So another thing I want to try with you is called interoceptive therapy. It's a technique where we bring on some of the symptoms of your panic attack, your physical ones, such as your heavy breathing or feeling dizzy or feeling tingling in your fingers. And through this, will help to overpower yourself through those physical feelings. The beginning of your panic attack is the internal bodily response, where you start to feel like you can't breathe or you're starting to feel dizzy. How do you feel when you start to feel like your breathing's being shortened?
I get scared and I know that I'm going to have a full-blown panic attack.
Okay, that sounds pretty normal for people with panic disorder. The point of this exercise is to make it less scary when you do have a panic attack. How does this sound?
It sounds a little scary, but I guess I'll try.
Awesome. You said earlier that the worst part of your panic attacks is feeling like you can't breathe. When you're focused on the physical aspects of the panic attack, you can't change your thinking and calm down mentally. I want you to breathe through this straw for about 45 seconds and then describe to me the way your body is feeling. This will inhibit you from getting the full amount of air that you get normally. Focus on the way that you are feeling and do this exercise for the full time. If you don't focus, this exercise will not have the full effect.
Okay. Are you going to time it?
Yeah. All right, that's good. How are you feeling?
Okay. I'm out of breath and feeling a little dizzy, and my fingers are tingling.
Okay, good. Are these some of the feelings you get when you have a panic attack?
Yeah.
Okay, so the whole point of this exercise is to train your body to not fear these feelings. Just like if you were training your body to lift something heavy, you have to practice and do multiple repetitions every day. The more you do these exercises, the easier it will become. Do you think this is something that you can keep up with during the week before we meet again?
Yeah, I think I can do that.
All right, awesome. Thank you. In conclusion, Mandy felt that learning about cognitive restructuring will help her when trying to calm down from a panic attack and will work well with deep breathing. She also feels confident that trying interoceptive exposure exercises will help her fear her panic attacks less and in turn will help her overcome them.